name is Jenny Lee Almeida, pronouns she, her, and I am a bilingual mental health educator here at CMHA Windsor-Essex County Branch. It is my pleasure to offer an overview of all the wonderful specialized programs and services that we offer at CMHA Windsor-Essex. I'd like to start off with our mission and our vision. CMHA Windsor-Essex is the lead provider and advocate of specialized community mental health and addiction services integrated with comprehensive primary healthcare services. Our vision is really mentally healthy people in a healthy society where, mental health is our sole focus. We really value a person-centered approach, accessibility, excellence in providing evidence-informed best practices, and really taking a lead role in achieving excellence in mental health and primary care services. On this slide, you will see the myriad of specialized programs, our CMHA Health Center, and our Sole Focus project, in which really focused on mental health awareness, education, and training. I will speak to all three. First, what we'll focus on is CMHA specialized programs and how do you get connected? How does an individual get connected to supports and services within CMHA Windsor? Our coordinated access team, information and referral. These individuals are providing referral assistance and essentially information on community resources, and you would be referring and speaking to an individual in coordinated access team to get connected to supports and services. So what does the referral process look like? Really, we wanted to ensure that individuals are not resharing their story over and over again. So anyone interested in receiving any type of mental health supports and services within Windsor-Essex County is really encouraged to connect, calling 519-973-4435, and you would get in touch with our coordinated access information and referral team. Hospitals, community providers, self-referral, all of those are ways that you can get connected. Now, what are the types of programs and supports that someone in the community could receive? It's important to understand that all services and supports received at CMHA are free. There is no cost to an individual. And really, the services are really focused on providing, independence and improved quality of life in an individual's journey of healing and recovery. So the focused recovery program really follows a stepped care model, matching a level of service with the level of support required by an individual based on their diagnosis and recovery goals. So when an individual is contacting information and referral coordinated access, our colleagues are going to, hear the story, listen to what are current, maybe roadblocks for the individual, and really try to match that individual with the best program or service. And if it's not at CMHA, then our coordinated access team would be making the referral and offering community resources. So the eligibility for all of our programs at CMHA Windsor-Essex County Branch is really focused on providing adults 16 years and older presenting with a serious mental illness. Again, self-referral, doctors, hospital referral, a family member can call and refer police and Crown. So I'll get into a little bit more about the focused recovery program, but within the focused recovery program, we're going to also see that we have a myriad of specialized programs, one being the Justice Support Program. So really, this is supporting individuals that may be involved or at risk of becoming involved in the criminal justice system. So, our workers really focus on a connection to a court support worker who's going to link them to other mental health services and treatments. Again, eligibility is 16 years and older, and an individual being referred to the Justice Support Services would have to have, an involvement either in the criminal justice system, or there is a risk of an individual becoming involved. And again, self-referral lawyers, doctors, family members, police, and community agencies are all able to call coordinated access and refer someone to the program. So building on what is that focused recovery program, what does recovery look like for a person? And that's going to be very unique for each individual. So when an individual starts in a program, there's going to be a comprehensive assessment with the individual living skills survey, and it's going to help identify areas for goals to really inform a recovery action plan. So recovery action plan really becomes a blueprint for an individual and a mental health and addictions worker to articulate goals, but identify how are we going to meet those goals. And so, this could involve just mental health and addictions work and the individual, but it also could involve bringing in other service providers and or family. Reassessment is ongoing throughout that recovery journey just to ensure that, we're meeting those shifts in treatment or intervention or planning just as needed. So this is really a collaborative process with an individual that is the center and strength-based. So CMHA focused recovery program goals. I just like to show this for anyone that's interested in receiving supports and services, but might be a bit hesitant. What does that look like? What would we be working on? And again, these are a whole bunch of things. You could be working on building a toolbox for life, right? Tools, resources during service, such as stress management, coping, assertiveness, increasing our distress tolerance, working on life skills, working on emotional self-regulation. A mental health and addiction worker would be continuously providing resources, informing an individual, where is crisis, where's a walk-in service outside of CMHA. And really, we're building on those domains and goals, essentially, that's been identified by the individual. And this is going to be, reviewed continuously to ensure that we're meeting the person where they're at, really focused on their own recovery journey. So more specialized programs offered at CMHA. And again, you're contacting Coordinated Access Team, and that is our information and referral, and they can be contacted. And we really wanted just one number, and the phone number is 519-973-4435. You'd be asking for CMHA Coordinated Access. So we also have dual diagnosis and a concurrent program. So for dual diagnosis, the services are really focused on providing an individual services and supports with a pre-existing developmental disability and also a mental illness. So this is a program psychiatrist is involved in assisting with consultation and follow-up and recommendation for treatment. Eligibility is 16 years and older, presenting with a mental illness and a developmental disability. So the referral process is a bit different for dual diagnosis, where the referral would be coming either from Windsor Regional Hospital, a physician, and or community living. We also at CMHA offer concurrent program. So this is, group support, but also individual support. And this is really focused on an individual that is, dealing with a mental illness and also substance use misuse. So we also have groups embedded within our concurrent program. We have a stages group, and that's sobriety through accessing group education and support, providing ongoing maintenance and peer support for individuals that have already received treatments for addictions. We have our REACH program, and that's Recovery and Education Creating Hope. So this is a 4-week skill building for groups of individuals who want to learn the basic skills to reduce or stop their substance use. We also provide support for family in the form of education groups for individuals that have a loved one living with a concurrent disorder. A referral process, again, you are calling the coordinated access, as self-referral community agencies can refer as well. We also have our early intervention program. Early intervention program is a very unique specialized program that provides early identification, assessment, and treatment for anyone experiencing a first episode psychosis. With the eligibility, individuals are 14 to 35 years of age experiencing a first episode psychosis and who have not received any previous treatments for their psychosis. The referral process is physician. So if you are curious or interested in early intervention program, this would be a referral process directly from your general healthcare practitioner. We also have community treatment orders. This individual, this worker would assist an individual by providing treatment, care, and supervision in the community, essentially, instead of remaining in hospital or having a longer stay in a hospital or essentially even being hospitalized. So a community treatment order mental health and addictions worker really plans and identifies what the individual and their supports must do to help them stay well and essentially out of hospital. Individuals 16 years and older with a history of repeated hospitalizations needing to meet that criteria for an application to be referred, or this could be a referral from a psychiatric assessment under the Mental Health Act or by a physician. CMHA, Windsor-Essex County Branch. It's also important to know that once an individual is in service, we do have housing-based services. So we have the Homelessness Initiative Program. So this is, a service that provides supported, subsidized housing for anyone who is at risk of being unhoused or becoming unhoused and who has or is currently experiencing a mental illness. This program works with the private market landlords in the community. What is the eligibility for the housing-based service? The individual will already be in the recovery-focused program. So anyone over the age of 16 years and older experiencing a mental illness and is already involved in focused recovery program. We also have Safe Beds. Safe Beds provides at-risk individuals with temporary housing. Individuals are 16 years and older, and referral really is coming from our police or community partners like Coast, LaSalle Mental Health Services team, or the CMHA Windsor-Essex County Branch Justice team as well. These are individuals that are not at risk for self-harm or harm to others. They're able to safely support themselves in the community. They have had direct contact with police and are currently experiencing mental health or addiction issue. Within CMHA, we also offer therapy. So therapy is one-to-one counseling, psychotherapy, and treatment for individuals experiencing moderate to severe mental health conditions, such as depression, anxiety, post-traumatic stress injury, trauma, and complex grief. The goals really are to reduce symptoms, improve coping, and well-being. Treatment lengths really is going to vary because it's really meeting the person where they're at. So it could range from 6 weeks to 12 weeks. Eligibility, this is open to any individual that is presenting with moderate to severe symptomology. And referral process is calling coordinated access or being referred by a CMHA staff member. Within our therapy program, we also have our GriefWorks program. So this is short-term activity-based clinical intervention for children and adolescents up to 18 years of age. The therapeutic intervention groups for similarly aged children are for those who have experienced the death of a loved one. Support and education is provided for the child, for the family, by professional caregivers within the social environment. So this is for basically a child, through to high school. So if the child is in school, they are eligible to be referred to the GriefWorks program. And this is for individuals, children who have experienced a recent loss through death and are a resident of Windsor-Essex County. We also offer numerous bereavement services in the form of groups as well as seminars. The educational seminars are really recommended for those presenting with normative grief and really seeking grief and bereavement-based services. Really, the focus is on understanding reactions to grief. What are the realistic expectations when grieving? Touching and focusing on healthy coping strategies and tips for how to grieve, good grief. Just a list of groups, for example, adult grievers, educational support group, pregnancy and infant loss educational support group, bereaved parents of older children, peer support. Remember Our Children group. These are individuals whose child of any age has died, can choose to transition to this group after doing so, after attending the bereaved parents of older children group for 2 to 3 years. We have spousal loss education support group, spousal loss aftercare group, as well as survivors of suicide loss education support group. Really important to know that if you are interested in any of these bereavement services in seminars or groups, these seminars are offered in person as well as virtually. If you are curious and would like to find out more, visit www.cmha-windsor.ca. We also have a lot of outreach programs in our community. One is which the mobile outreach and support team. So this provides supports to individuals that are on the street involved and may need direction on housing, personal care, mental health, and addictions. So these individuals provide assessments, delivery of basic supplies, awareness and access to community services, connections, and referrals. It operates 5:30 to 9 p.m. and our partners are Hotel du Great Healthcare, CMHA, Family Services, Windsor-Essex, and Assisted Living, Southwestern Ontario. Other community partnership programs, mental health counselors at St. Clair College. So this program offers therapy, crisis support, and referrals for St. Clair College students experiencing life struggles, mental health, and/or addiction. This is located at the Windsor main campus, room 164 at St. Clair College. You can call the campus health center or student support services. So this is for post-secondary students currently enrolled at St. Clair College. We also have mental health navigators embedded at the City of Windsor. They provide coordinated access to CMHA services and external services navigation to really support an individual in their mental health and addiction recovery journey and needs, and participating in the City of Windsor Ontario Works program. So our mental health navigators are located at the 400 City Hall Square building, and individuals can self-refer or they're referred by their Ontario Works caseworker. A new addition to a myriad of services was our Wellness and Recovery College. Recovery colleges are really unique. It's a unique learning environment that offers individuals an opportunity to learn about and focus on personal recovery within mental health and well-being. Courses really are co-developed, co-facilitated by a trained peer support worker and available in person at no cost. The lived or living experience of the peer support worker really helps to provide guidance, foster a culture of hopefulness, and reveal new possibilities and opportunities. So it's really important to know, these courses, what can I anticipate? Wellness Recovery College offers each semester 2 hours in length, 4 times throughout the semester. So these bite-sized courses takes a look at the different dimensions of wellness and how it affects our daily lives. So these courses provide information on self-care, on stress development, well-being, opportunities for discussion amongst peers, students, in really a safe, confidential setting. So all, as mentioned, 2 hours in duration, offered 4 times throughout the semester. And just to show you, a little bit introduction to wellness, journey, coffee conversations. So I know it says on the slide 1 hour in duration. This is now changed, and this is now offered 2 hours in duration, 4 times throughout every semester. To learn more, visit www.windsor-essex.cmha.ca/wellness-recovery-college. Important to know that we also have our Youth Wellness Hub. And, the right services essentially for youth and their families. So Youth Wellness Hub is really an initiative that aims to bring the right services to youth as well as family at the right time and in the right place, the right location. So the Youth Hub is a critical step forward in improving Ontario's mental health and addiction services for youth and young adults. It provides rapid access to easily identifiable mental health and substance use services, providing walk-in, low barrier services, and clear service pathways. It's really evidence-based interventions to match an individual's level of need, to provide support through transitions, and integrating mental health, substance use, primary care, vocational, housing, and any other support services into kind of a one-stop shop model of care offered in a youth-friendly space. Windsor Youth Wellness Hub. As I'm recording this video, our Youth Wellness Hub has a new location, and permanent new location is 215 Eugenie West, Unit 106, and this will be opening July 19th, 2023, open Monday to Friday, 1 p.m. to 7 p.m. There is no referral necessary, provides walk-in services for youth aged 12 to 25. What do they offer? As you can see on the screen, they offer support for mental health challenges, substance use challenges. They offer primary care, peer support groups with one-on-one, educational groups, and numerous recreational activities. To learn more, I really encourage you to check out www.youthhubYQG.com. And that is it for all of our mental health and addiction programs under specialized programs. I'm now going to speak on our CMHA Health Center. Our CMHA Health Center offers primary care services for the health needs of individuals and families across their lifespan. It operates really under a collaborative care model where an interdisciplinary team of family physicians, nurse practitioners, and other healthcare professionals take a holistic approach to patient care by addressing both the primary and the mental health needs of the population they serve. Staff at the health center work very closely with CMHA mental health and addiction workers to address the mental health and addiction needs of an individual who's at risk and presenting with primary care issues. So the eligibility for our CMHA Health Center, this serves all ages, and this is for all healthcare needs. And again, we specialize in helping support those experiencing serious mental illness. The referral process can be completed in person at 1400 Windsor Ave, or please visit www.cmhahealthcenter.ca to complete your referral online. Programs open to the community from CMHA Health Center. There are numerous programs offered throughout the year based on interest and as well participation. Upcoming offerings can be found on the events page at www.cmhahealthcenter.ca. For example, listed on the slide, overcoming anxiety group, overpowering depression, chronic pain management, smoking cessation, breathe easy, healthy minds for life, nutritional webinars, and yoga for healthy living are just to name but a few. We also have programs for registered clients of the CMHA Health Center. These include diabetes education and treatment, dietary and nutritional services, foot care, low back pain program, physiotherapy, massage therapy, chiropractic services, primary health care, psychiatric care services, respiratory therapy, nicotine replacement therapy, and as well, therapists embedded at the CMHA Health Center providing mental health one-on-one therapy. And to finish off the CMHA overview, I will now speak and touch on the Soul Focus project that really is mental health promotion, education, training, and fundraising. And the focus really is on providing evidence-based suicide intervention, education, mental health training for professionals, employers, community at large, educational institutions, and the general public. We offer training programs and workshops for professionals, employers, educational institutions, general public, youth, and also individuals who work within are helping professionals who are caring for an individual with a mental illness. Programs are offered in both English and French by qualified, certified educators. Our workshops provided can be found online, or we tailor workshops really based on meeting the need in the community. If you are curious and would like to find out more, certainly visit www.windsor-essex.cmha.ca and click on Mental Health Promotion to explore our services. Offered workshops include bereavement education, living life to the full program, suicide intervention skills training, mental health works, mental health in schools, and so much more. We also, within our mental health education and promotion team, we have a workplace outreach worker. They promote psychological health and safety in workplaces throughout Windsor-Essex County. They do this through consultation, mental health well-being workshops, and offering on-site services for employees, such as service navigation, information, assistance with referrals, and one-on-one confidential short-term therapeutic support. I will now speak on additional resources that I think is important just to mention that we have access in Windsor-Essex County. Important to know that the Mental Health and Addictions Urgent Care Clinic is provided at 744 Olette, Monday through Friday, 11:30 a.m. to 7:30 p.m. The Mental Health Urgent Care Clinic really provides assistance for preventing an urgent situation from becoming an emergent situation. So this is for anyone that is needing a consultation, assistance, a referral, even speaking in regards to medication, a consult. Really the hopes is getting an individual supported and connected with the Mental Health Urgent Care Clinic to prevent hospitalization or prevent symptoms from becoming extreme and distressing. phone number for the Mental Health Addictions Urgent Care Center is 519-257-5111, extension 77968. We also have the Crisis Mental Wellness Center. They can be reached at 519-257-5224. If you are interested, please at any time contact CMHA to learn more about any of the services I've just discussed. Our phone number is 519-255-7440. We also have our community crisis. They are open 24 hours, 7 days a week, 519-973-4435. And last but not least, Regional Children's Center and Counseling Clinic can be reached at 519-257-KIDS. So again, the number for the Regional Children's Center Counseling Clinic is 519-257-5437. I hope you've enjoyed the overview of the plethora of services and supports offered here at CMHA Windsor-Essex County Branch. Please don't hesitate to look at our website, visit us, and follow us on any of our social media handles at CMHA-WECB on Facebook, Instagram, LinkedIn, and on Twitter. Thank you kindly.